Good evening, friends. I am Dr. Bhupendra Prasad Sharma, a senior consultant surgeon and in charge of a burn unit in Nemcare Hospital, Guwahati, Assam. I will be talking on burns, different aspects of burns, and as a first lecture today, I'll be giving my thoughts about epidemiology of burns, and also I'll talk on the structure and functions of skin. Now, as you are all aware, burns are the most devastating injury that the human body can encounter. It is the fourth most common type of trauma worldwide. And 90% of burn injuries occur in low and middle income countries of the world. Now, coming to the other aspect of burns not only damages the skin, it also causes damage to the internal organs. It is a physical as well as a mental trauma. As you can see in the photographs, a young girl, if she suffers from injury of the face, she'll be all the time worried what will happen to her. Even if she becomes all right, will she get back the same type of face she had earlier? Similarly, a person who is working, if he gets this type of burn injuries of the hands, he will also be worried. Shall he be able to work again afterwards? So it gives a lot of mental trauma to the patient. There is always a problems of rehabilitation of burn patients. Burns are also a social as well as the legal problems, and the treatment of burn is expensive, and of course it is not as satisfactory as you want. Now, 75% of the burn accidents occur at home, and 80% of the victims are the young women and the children. Of course, the incidence of burns amongst the males are also increasing nowadays because of the terrorist violence, plane and train accidents, and of course, the industrial accidents. Now, burns to adult females mostly occur at home, whereas adult males suffer from burn injuries mostly outdoor, maybe at work locations. It is also said that 84% of the pediatric burns occur at home because they stay at home. Now, coming to the Indian scenario, as you all know, there is high morbidity of burns everywhere in the world. Coming to Indian situations, the burn injury occur in a low socio-economic group, and hence there is high morbidity. There is always overcrowding in this type of people. There is unsafe housing and unsafe cooking methods, as you can see in the photographs. Poor standard of safety at workplace. Poor transport facilities, so whenever they get burn injuries, they are always led to come to the hospital. There is high illiteracy, so they do not know what to do. And of course, the lack of knowledge and information of burn injuries. According to National Health Portal of India, 7 million of people suffer from burn injuries every year. Out of them, about 0.14 million die every year, and 0.24 million suffer from various disabilities. Yes, there are a lot of problems of burns. What are those? High incidence amongst the young females and children, as I've already said. High incidence amongst the poorer section of society. Scarce facilities of treatment in burns. Of course, high morbidity and high mortality. And even with minor burns, many patients develop disabling deformities, as you can see in the photographs, as you can see. But is there any silver lining? Of course. Given proper care, at proper time and proper place, many lives can be still saved. Proper first aid reduces the complications. Nursing care given by trained nurses can reduce morbidity as well as mortality. With modern and scientific treatment, many burn injured patients can live a normal as well as a dignified life. So these are the silver eye. The key to save the life of a burn patient is to provide quick and correct treatment as per updated guidelines with life-saving interventions. If need be, to transfer the patient to a dedicated burns unit, and of course the nursing personnel and doctors need to be trained in all such life-emergent interventions to reduce the morbidity as well as mortality. Now let us talk something about the structure of the skin. As you all are aware, burns injure the skin most, and of course the other organs later. Now let us talk something about the skin then. Skin, as you know, is the largest organ of the human body. The outer layer, there are two layers of skin. One is the outer layer, which is called the epidermis, which is a thinner layer, this one, and the inner layer, which is thicker. This is called the dermal layer, dermis layer. Now coming to the epidermis. The epidermis is made up of stratified squamous epithelial cells and basal layer of columnar cells, as you can see in the photographs. These are epithelial cells, which are the epithelial cells, and these are the columnar cells at the base. The epidermis is devoid of blood vessels, but has the ability to regenerate by epithelialization. It consists of 5 layers. One is the stratum corneum, which is the outermost layer. Then comes the stratum lucidum, stratum granulosum, stratum spinosum, and of course the stratum basale or the basal layer. Keratinocytes and the melanocytes are located in the epidermis. As you can see here, these are the melanocytes. Now something about melanocytes. The melanocytes are the cells which really give the pigment melanin, and which is the cause of yellow coloration of the skin. So if the epidermis is burned along with the melanocytes, then the skin afterwards doesn't have the yellow coloration, and that's where the skin becomes white. That has to be remembered, but we'll talk the other aspect of burns. Now coming to dermis, the dermis consists of the collagen, elastic fibers. The blood vessels are present in the dermis, as you can see here. There are nerve endings, as you can see here. The sweat and the sebaceous glands. The hair follicles are also located in the dermis. Then structurally, it has got 2 parts. One is called the papillary part, which is thinner one, this part. This is the small part of papillary region. And the other is a reticular part, this lower part. This is the thicker part. The dermis is only a supportive organ. It has got no property to regenerate by itself. And hence, burns involving dermis heal with fibrosis and always form scar unless you replace it. Now coming to the last part of today's lecture, it is the functions of the skin. It covers and protects the internal organ of the body. Skin being the largest organ, it covers and protects the internal organs. It prevents internal invasion by microorganisms and thereby prevents infection often. It regulates the temperature and water content of the body. If there is more water, it allows the water to go out. If there's more heat, it allows the temperature to go out. It also acts as an excretory organ of excess water and salt. It acts as the sensory organ of the body. Perception of different types of sensations like touch, pain, heat, cold are some of the functions of the skin. In addition to that, it can produce vitamin D in presence of sunlight. So these are some of the functions which are very, very important in the skin. Though skin is an excretory organ, we have to deal with the skin because we will be talking more about burns which involve the skin. With this, I thank you very much for listening, and I will be giving more lectures on different types of burns and different aspects of burns. Thank you very much.